Good afternoon, everyone. Thank you so much for being here in advance of this weekend's DEA Drug Takeback Day. I am Kelly Juleson. I'm the co-president of the Governor's Prevention Partnership. And just wanted to thank you all for being here today. This legislative session has been so critically important as we've had discussions around the importance of safe storage and safe disposal of our unwanted and unneeded medications and why we need to take action. This is about saving lives. Last year in Connecticut, 1,398 people overdosed from unintentional drugs here in the state, and it's just far too many. And how can we take action? And that is what take-back opportunities are so critically important as we consider what we can do for each of us to take action. We at the Governor's Prevention Partnership started a project back in the fall called Prevention Starts With You, where we are sending home at-home drug deactivation and disposal pouches, which I have right here. And today is about talking about all of the various ways that we can safely dispose and deactivate of our medications. And just very quickly, I'll show you how this works. You can pour your liquid medication or your pills into this pouch. And I know in advance of Drug Takeback Day that liquids typically aren't accepted, but you can put your liquids right in here. This will take 6 ounces of liquids, and this is just some old Tylenol that my children had. Add some water. You can hear a little sizzle. Sizzle, sizzle. Close it up and throw this in the trash. And so for us at the Governor's Prevention Partnership, it's about yes and. What are all of the various options that we have when it comes to safely disposing of our medication? And we're so thrilled to have partnered with Senator Anwar, Representative McCarthy Vahey, Senator Hwang, Representative Wood, and there's so many other advocates who have led these conversations here at the legislature this year. And of course, for the constant leadership of Commissioner Navarretta in the Department of Mental Health and Addiction Services. We're very honored today to have a student with us who's part of our Youth Advisory Board, Neha Shanavas. Neha, I'm sorry, I should know your name constantly at this point because she's done a tremendous job advocating for the importance of prevention at her local school, which is the Sports and Medical Sciences Academy here in Hartford, where, of course, they had the unfortunate overdose death of a middle schooler. So, Neha, I'll turn it over to you. Thank you for being here.
Thank you. Good afternoon, everyone. My name is Neha Shanavas, and like Kelly said, I'm a senior at the Sport and Medical Science Academy in downtown Hartford. I'm also part of the Speakers Bureau of the Governor's Prevention Partnership Youth Advisory Board. I was motivated to join GPP in November because a student passed away at my school 2 years ago from a fentanyl overdose. I really want to help them in their fight against substance prevention amongst youth. I was able to witness firsthand how badly that overdose affected my school and our community. It's common knowledge that there's high rates of opioid use in the U.S. In fact, among the ages 15 to 24, they have the highest rates of opioid misuse, and they account for 10% of drug overdoses in the country. Another issue that we see is accidental consumption of opioids from young children who have access to them at home, and this increases their risk of accidental overdoses. So this is why these drug disposal methods are extremely important. The deterra drug pouches that's mentioned in Senate Bill 1 provides a safe, easy, and environmentally friendly way of disposing of drugs. In conclusion, I call upon educators, policymakers, and the general public to increase awareness on the importance of drug disposal methods. And I urge everybody to stand up in this fight against drugs because it's in every single part of our community. It's in our schools. It's in our places of work. And the drug disposal methods really provide a way for us to reduce the risk of overdoses in our community. Thank you so much.
Thank you so much, Neha. I'd like to turn it over to Commissioner Nancy Navarretta from the Department of Mental Health and Addiction Services. Commissioner.
Thank you, Kelly. Good afternoon. Thank you so much for inviting me to be part of today's event. I'm Nancy Navarretta. I'm the Commissioner of the Department of Mental Health and Addiction Services. I would like to thank the Public Health and Insurance Committees and the Governor's Prevention Partnership for hosting this event and for the work that they have done to really elevate Drug Takeback Day and other prevention initiatives targeting substance misuse. By working with Connecticut communities, we continue to fight to eliminate drug overdoses, fatal and non-fatal. I'm proud to say we are seeing success, but will not rest while people continue to be at risk. Unused prescription medication in our home medicine cabinets is one factor that can increase the risk of misuse and accidental drug overdose. This is a point of access that can affect young people as well as older adults or seniors. We can prevent it. Let's build upon last year's Takeback events when Connecticut eliminated over 9,000 pounds of medications. Another innovative initiative championed by the Governor's Prevention Partnership is the unrelenting distribution of the medication deactivation and disposal kits you just saw. These kits can be used anywhere, anytime, and thrown into the regular household trash, eliminating the risk of misuse. Simply stated, these outreach initiatives, such as the disposal kits, will save lives, and I am proud to stand with our partners to support these endeavors. Due to the work of many, Connecticut has seen 2 years of decline in overdose deaths, but the expanse and lethality of the opioid crisis demands continued vigilance and enhanced efforts to sustain this impact. New resources are coming to Connecticut thanks to Attorney General Tong's office and the work on settlement agreements with opioid manufacturers, distributors, retailers, and marketers that will bring hundreds of millions of dollars into our state to help abate the crisis and prevent additional harm. Presently, our Settlement Advisory Committee is working on a funding recommendation to increase the number of deactivation kits available, as well as providing support for harm reduction supplies, treatment access, and public education efforts. By raising awareness of the dangers of unsafe medication disposal and encouraging adults to take steps to secure any potential harmful substances in their household, we can reduce unsafe access to drugs that can be misused. This will have a tangible effect on families in every community of this state. Drug Takeback Day, our continued prevention efforts, and the tremendous partners we have here today are key to providing support and education to families and communities. Thank you for being here, everyone, and having this conversation. I look forward to continuing this work.
Thank you, Commissioner. And now we'd like to have Senator Anwar, the chair of the Public Health Committee, who was one of the initial champions of Senate Bill 1, where this language was included to co-dispense deterrent deactivation kits with opioid and benzodiazepine prescriptions. Senator?
Thank you. Every day should be a drug take-back day. Every moment should be a drug take-back moment. And I think this is what this conversation is about. By the end of the day today, 4 more people in our state will die. These will be unintentional overdoses. And this is something that the Public Health Committee, this body, this legislative body over here, every year we are trying to see what are the various things that we can do. It will require every hand on deck. It will require multi-pronged approaches, but this is one very important piece of the solution. This is not the magic bullet, but it's a very important part because the more medications that are in homes or on the street, the more dangerous it is. And if you start to listen to some of the stories, some people's individual pathway towards this is from medications that have been easily accessible to them. While some of these medicines may be needed for individuals, we don't need them to be sitting around forever. And this is why this is important. I'm honored to stand here with the Governor's Partnership, Prevention Partnership, with Kelly and Hannah. You are superheroes. You've been working on this and you've been raising this awareness across our state, and this is so important. Commissioner, your work has been amazing, and an amazing work that you have been doing in so many ways. Our DMHAS does work which is actually considered cutting edge in the industry. If you start to talk to people in other states and you start to share what we have been doing in the state of Connecticut, they would say, oh, that's a great idea. We should look at this. We say, well, we've done that, been there, done that, proven it, and we are increasing it. So, Commissioner, thank you for your work. And I'm also thankful for DEA for the work that they're doing. And Senator Lanzoni and Senator Duff have made this a priority. They wanted this to be in Senate Bill 1, and my co-chair, Representative Cristin McCarthy Vahey, she's a partner. She has been every step of the way making sure that we are doing everything that we can in every possible way in every session to be able to help address this challenge, a preventable cause of death of our people, our community, our neighbors, our children, our friends and community members. So this is why this is critical. So I just want to touch on a couple of things. Senate Bill 1 is looking at how we can make sure that the access to this is going to be easy for individuals who are going to be able to get prescriptions, who are getting the prescriptions for opioids. We want them to be able to have accessibility to this product, which is the drug deactivation pouches. These drug deactivation pouches are truly going to be able to help us, but right at the point of getting the medicines. And the way we do this is going to be through a number of mechanisms. One is we are asking through the bill for Governor's Prevention Partnership to be a group that would ask for funding from OSAC, the Opioid Settlement Advisory Committee, because the funds have to be coming through a grant. There are federal grants that have been very successful through our federal leaders who have been able to do this. So this is already shown to be effective. We are also hoping that there would be an effort to have at the point of receiving the medications information of requesting these pouches through the website would be another option. Having something in the DMHAS website is going to be critical. And then we are hoping to have DMHAS sit with OPM as well as Connecticut Insurance Department to look at the mechanisms for payment for this in future. This would allow us to be in a better place as a state to be able to pay for this as people get this. One important information is this is effective not only against opioids, it is effective against every other very drug that's available. As a critical care doctor, I have seen far more than my share of people dying from unintentionally or intentionally from various medications. And one of the common thread was it was accessible to individuals. And that very moment, at some weak moment, people took the medicines that were accessible to them. But antihypertensives, antipsychotic medicines, depression medicines, anxiety medications, you name it, they are going to be able to be deactivated through this mechanism. So the more we have these mechanisms, we need to get to the point that every day becomes a drug take-back day. Thank you.
Thank you, Senator. I think that's such a critical message, make every day drug take-back day. And I'd like to introduce Representative Cristin McCarthy Vahey, who is the House's chair of the Public Health Committee. Thank you.
Thank you so much, Kelly. Thank you to the Governor's Prevention Partnership, to our Commissioner, and to Senator Anwar for your constant and relentless fight against this epidemic that we face here in Connecticut. And it's an epidemic that faces every single community. I think sometimes in our communities, we'd like to think that it's not here, it's not us, but it is all of us everywhere. And I think it's important for us to know, given that it is all of us everywhere, what the options are for safety, for prevention. And I really am so grateful to the Governor's Prevention Partnership for giving us just more and more information. I know we keep holding this up, and it's an important tool, and the opportunity to actually see how it works. Thank you for that, Kelly, because yes, liquids are not usually accepted at drug take-back days, but this is an option. I was at physical therapy this morning talking to the therapist about this who had no idea that this was even an option. We want to make sure that all of our providers, that all of our patients, that all of our schools, that everyone knows that this deactivation pouch is an option for them to use in addition to the drug take-back locations. This is an ongoing partnership. This is an ongoing effort. And Senator Anwar, I think, put it very well. There are so many aspects to this effort, and this is one very important piece of the many things that we see the Governor's Prevention Partnership, our commissioner, and together all of us as legislators are doing. So we are going to continue this work together with the Opioid Settlement Advisory Committee, which has been doing tremendous work along with our Alcohol and Drug Policy Council to be sure that we are stopping the deaths. We need to keep our residents alive. This is a way that we can help keep people alive. So thank you, Kelly, for the opportunity to speak and be with you today.
Thank you, Representative. And I think Representative McCarthy Vahey underscored some really important points as well in terms of access and providing opportunities and considering all of the available options, whether it's the semi-annual take-back day, taking a product like this and using it at home, or going to your local police department. It is just so critically important to get those unneeded and unwanted medications out of your home. Now it gives me my great pleasure to introduce Senator Hwang, from the Insurance Committee, who was a critical leader as that bill was being considered as well during the legislative session. So, Senator.
Thank you, Kelly. And if I may cede my spot beforehand, I don't know what was on the schedule, but Assistant Special Agent in charge of the DEA, Drug Enforcement Agency, Mr. Lanzoni, could I afford him the chance to speak before I do? Thank you. Please.
Sir, thank you very much. Appreciate it. Thank you. Good afternoon, everybody. My name is David Lanzoni, and I am the Assistant Special Agent in charge of the United States Drug Enforcement Administration here in Connecticut. And I'm super pleased to be here today. I've had the opportunity to be part of the Drug Takeback since its inception, and it's a program that has only shown its benefit time and time again. As you may or may not be aware, this is a program that we offer biannually in October and sometime close to April. The Drug Enforcement Administration is going to hold its 26th National Prescription Drug Takeback Day this Saturday, April the 27th, between the hours of 10 a.m. and 2 p.m. This event offers free and anonymous disposal of unwanted medications, both prescription and over-the-counter. This is an opportunity for us to have many people attend thousands of drop-off sites and safely dispose of any prescription medications that they may not want and or need. I can assure you that the DEA is focused on a daily basis on combating the deadly drug poisonings that are happening in our country. And we are committed to continue to work with our state, local, and federal partners at saving lives. The National Prescription Drug Takeback Day is just one way that we can help contribute to prevent medication misuse. Working in close partnership with all of our local partners, Takeback Day has removed nearly 9,000 tons of prescription and over-the-counter medications from the streets since the inception of this event. Every year, we collect tablets, capsules, patches, and other forms of prescription drugs. I apologize, but at this time, and as it has been in the past, the DEA collection sites will not be able to accept syringes, sharps, or any known illicit drugs. A location finder is available at DEA-take-back.com for easy access to nearby collection sites. Beyond DEA's Takeback Day, there are also opportunities to regularly safely dispose of unneeded medications to close to 17,000 pharmacies, hospitals, and businesses working to collect all unwanted medications in our country. Throughout the year, in addition to many of those other collection sites mentioned previously, a lot of police departments right here in the state of Connecticut has drop boxes within their lobby. And it is also an anonymous way to dispose of unwanted or unneeded medications. We truly hope to see you this Saturday, and thank you for your efforts in help keeping our community safe. Kelly, thank you for the opportunity for being here today. Thank you.
Thank you. I'm sorry for the change in the schedule, but I wanted to recognize our federal and local law enforcement who are such important partners in what we do. I'm State Senator Tony Hwang, the ranking leader, Senate leader on the Insurance Committee, and formerly the ranking leader on Public Health. So for me, this is a very important subject matter because this is about saving lives. And I know that the Take Back Day, the pouches, the incredible initiative of GPP in regards to information, education, awareness, and one of the most instructive parts of it is the mentorship program to understand that young people, particularly, are easily impressed. And it is that kind of a relationship that they have that fills the void that leads them to the temptation of drug utilization. It's ironic. It truly is ironic that as I was interacting with a bunch of high school students this past week, I jokingly said to them, I said, do you know what 420 means? I'm stunned. Every single high school student knew what it meant. So the drug prevalence culture is so pervasive in our schools that it has made such an impression that it's become standard fare. This is what we're doing in talking about drug take-back, talking about law enforcement, the lure and the danger and the death of fentanyl. But none of it can surpass what is getting passed as standard fare. And I think what we need to do better as legislators, as community leaders, as thought leaders, in addition with our law enforcement and our educators and our community nonprofits, is to raise the awareness about the dangers of drug, the danger about losing loved ones, the real impact that occurs when innocently, for a good time, quote unquote, you could forever sink into a lifetime of addiction or even worse, tragic death. So this is about raising awareness to saving lives. And the work continues. And I'm glad that GPP has been led by co-chairs that are such inspirational leaders in going out and spreading the gospel. But at the same time, it's also incumbent for us as legislative leaders to support you in every bit of your endeavor and support you legislatively, financially, and voice-wise. So I'm privileged and honored to be here, but ultimately, it is you in the audience. And I wish there were many more in the audience that could spread the gospel of drug prevention, drug awareness. Because unfortunately, the popular culture is we're going to get a room full of TV cameras when there's a tragedy, when there's a tragic loss. As this young, fearless leader mentioned, she was driven to action when the loss of a schoolmate due to fentanyl drove her to action. But I still remember the TV coverage lasting days. Where is the coverage to talk about awareness and prevention today? I hope GPP and their leadership and their initiative has become that effort to raise awareness, because we need to let our young people and people in our community to know that dangerous lure of drugs, and we need to prevent that. So thank you very much for being here. And I want to take a special shout out to the incredible leaders that are doing this day in and day out. And thank you. Thank you for saving lives.
Thank you so much, Senator. Thank you, all of you, for being present with us today. We're happy to take any questions if anyone may have any. Since I don't see any, hopefully you leave here today. We do have the drug deactivation and disposal kits ready to go. If you would like to take them home, we can bring them out to your community. If you are able to go on Saturday to one of the Takeback locations in your own communities, please do. It's so critically important that we get these unneeded and unwanted medications out of our homes and safely dispose and deactivate them. Thank you so much and have a great afternoon.